In recent years, Vietnam's health sector has strived to provide good healthcare service for the community. Network of healthcare and protection from the local to national level has constantly improved and enhanced the quality, of which initial healthcare and inline healthcare service gained positive results. For the disease with high risk of infection, such as HIV/AIDS, the detection rate of new infections has decreased, and people were encouraged to take the test and early treatment with the new approach. According to the World Health Organization, public health is one of the leading factors that reflect the level of socio-economic development of the country and the quality of life. Thus, the work of public health care is a very important part of the development strategy of Vietnam and play a fundamental role in improving the quality of life of each family and the entire society. In today's program, we'll talk to Ms. MONA BYRKIT, representative of Vietnam PATH. This is an international non-profit organization supporting appropriate medical technology and basis strategies to change the perception and actions of people towards health. She will share about the quality of public healthcare services and related programs in Vietnam.
Hello and welcome to Sharing Vietnam on VTC10 Netviet. In recent years, the public health care services in Vietnam has been paid much more attention compared to the last several years with the support of the international organization. However, there's still a lot of difficulties and challenges that Vietnam still faced and need to overcome in the next period. So in our program today, we have a talk to Mrs. MONA BYRKIT, the representative of the PATH organization in Vietnam. She will share her feelings towards the public healthcare services in Vietnam in recent years. Thank you, Ms. MONA BYRKIT, for joining our program today. Well, generally, what do you think about the quality of Vietnam's public healthcare services in recent years?
Yeah, the public health situation, services in Vietnam have vastly improved over the last 20 years, and we're seeing just those improvements noted in both the public and private sector. I think just incredible advances were made, even though there was a very strong infrastructure in the public health system for decades. The quality of service and the access for people, that took some time to really bring it up to a level that a middle-income country can be proud of. So I think we're seeing really tremendous gains, but obviously there's still work to be done in terms of quality of care and the standards being the same everywhere you go for healthcare at every level of the system.
Right. So among those, which one did you pay more attention to?
Initially, we paid attention, a lot of attention on maternal and child health and reproductive health. In the 80s and 90s, that was a big part of our focus. In the last 15 years or so, I would say we've spent quite a bit of time looking at vaccine and immunization work. And we've worked closely with the Ministry of Health and the National EPI program, we call it, to really increase access to life-saving vaccines. And we're very proud of that. We've seen really tremendous coverage rates in the country. From that, we really also in the last five to 10 years got more involved in infectious disease work. So, for example, addressing issues such as TB, tuberculosis, and HIV and AIDS, which have been problematic for the country for several years. So you're seeing PATH make some shifts to work on vaccine-preventable disease and other infectious disease. I think just now we're also starting to get involved in non-communicable disease as well.
Such a lot of works. So in the recent years, Vietnam has made a lot of efforts in improving the quality of the public healthcare services for Vietnamese people, especially the disadvantaged ones, and actively cooperated with the international organizations. So what do you think about this?
Well, I think it's been great. I think Vietnam does have many dozens of partners that are international NGOs, non-governmental organizations like PATH, working with them side by side on issues related to health, but other social development. It's really evolved as well. Our collaboration over the years has really grown and strengthened. I think there's a greater recognition by the government of Vietnam about the utility of international NGOs, particularly in terms of exchanging ideas and technical innovation that Vietnam can learn from other countries' experiences, but it's also a lot that we as international organizations can learn from Vietnam and then take to other countries.
In recent years, with the goal of reducing the incidence of infectious diseases, expanding immunization program of Vietnam has been implemented on a national scale. With the support of PATH, a number of outstanding projects have been implemented, as the project improving the quality of immunization services regularly in Hà Tĩnh and project of introducing hepatitis B in Thanh Hóa from 2002 to 2006. Besides, the program also implemented a number of measures to improve the quality of immunization services in 3 provinces of Phú Thọ, Quảng Trị, Bến Tre from 2009 to 2012. The program has contributed to enhance effective vaccines management through the standard operating procedures of the management and storage of vaccines, pilot softwares of vaccines management and immunization registry.
Đã và đang hỗ trợ các cái nhà sản xuất vaccine trong nước, ví dụ như là Viện Vaccine và Sinh phẩm Y tế Nha Trang, IVAC hay là công ty Vaccine và Sinh phẩm số 1 Biotech để là nghiên cứu phát triển vaccine cúm, bao gồm cả cúm A H1N1, cúm A H5N1 và cúm mùa, đồng thời là hỗ trợ cả việc thử nghiệm lâm sàng của giai đoạn 1. Đối với lại cái chương trình tiêm chủng mở rộng quốc gia thì PATH cũng từ năm 1998 đã có những cái dự án để giúp tăng cường năng lực cho cán bộ y tế, tăng cường cái hệ thống tiêm chủng, cũng như là xây dựng hỗ trợ chương trình tiêm chủng mở rộng quốc gia, xây dựng một hệ thống thông tin báo cáo tiêm chủng trực tuyến web-based. Và hiện tại thì cái hệ thống mà báo cáo tiêm chủng và quản lý vaccine thì đã được chương trình tiêm chủng mở rộng triển khai rộng rãi trên 63 tỉnh thành của toàn bộ Việt Nam. PATH cũng đã hỗ trợ Bộ Y tế để xây dựng các cái chính sách và hướng dẫn về sử dụng vaccine cúm tại Việt Nam. Và bên cạnh đó thì PATH cũng hỗ trợ để tăng cường cái tỷ lệ tiêm chủng vaccine viêm gan B sơ sinh tại một số tỉnh như là Hòa Bình, Hải Dương và Thanh Hóa.
According to the World Health Organization, Vietnam ranked 12th among 22 countries with high tuberculosis situation. Since 2007, with the fund from the United States Agency for International Development (USAID), PATH launched coordinating public-private healthcare in Hải Phòng. After a period of deployment, approximately 15% of TB cases of Hải Phòng was introduced from the private medical agencies, including pharmacies and private clinics. 92% of people at risk have access to local TB treatment and services. From 2011 to date, the national TB program implemented coordinating public-private healthcare in Vietnam successfully and applied in Hanoi and Ho Chi Minh City.
Từ năm 2008 đến năm 2015 thì tổ chức PATH, các cái hoạt động của tổ chức PATH cũng đã đóng góp một cách đáng kể cho chương trình phòng chống lao quốc gia. Cụ thể là gần 12.000 trường hợp mắc nao được phát hiện từ các cái hoạt động của tổ chức PATH, và trung bình là các cái hoạt động của tổ chức PATH đóng góp vào khoảng 16% tổng số các cái trường hợp lao được phát hiện hàng năm ở các cái tỉnh dự án của chúng tôi. Và quan trọng hơn là các cái mô hình thí điểm của tổ chức PATH thực hiện thì đã được mở rộng và tiếp tục duy trì ngay cả sau khi mà dự án đã kết thúc.
Along with the socio-economic development, people's lives have constantly been improved. The healthcare community should be innovated in terms of form and content. In a modern society, health is an important criterion to reflect the level of protection of human rights, humanitarian and social justice of each country. Therefore, public health is the responsibility of every individual in the society.
Coming back to our talk today, what do you think about the 2 projects above, TB projects and the vaccination? How will these kind of projects help to improve Vietnam's public health care services?
Vietnam can take a lot of pride in its work in vaccine and immunization. Let's start with that one. You have very high coverage rates for most of the routine immunizations in the country. Still some challenges, again, in certain hard-to-reach areas where we need to keep vaccine cold until it reaches the person that receives the immunization. I think the really exciting thing that we're working on as well is actually local manufacturing of vaccine. So, for example, we're working with a local manufacturer called EVAC on influenza vaccine manufacturing. So we'll be seeing a manufacturing facility that can provide excellent quality vaccine for the population of Vietnam, but potentially in years to come, the quality of that vaccine will be high enough that it will be available for export, potentially. And then when it comes to TB, we have a very strong partnership with the National TB Program of Vietnam. It's one of our very closest partnerships for about 8 or 9 years now. And we've seen, again, tremendous progress in terms of what we call case detection, case finding, helping people find out that they have TB and get on treatment quickly before they're exposing other people to TB. So we've seen really tremendous gains in terms of increasing case detection, decreasing the overall TB burden.
Right. So what advices would you suggest Vietnam to actively develop our own public healthcare services after the support of the international organization? And
I think any advice I would give is just to continue to look for innovative ways to finance public health programs, to engage the private sector in a meaningful way. So private providers that people in Vietnam can now afford to pay are an important partner for the public health system. That said, when working with the private sector, it's very important to ensure that there are quality standards, that the government plays a role in overseeing the type of service and the quality of service delivered in the private sector.
okay, so in your opinion, what are the appropriate policies for the public healthcare providers in Vietnam?
I think in terms of future, really again looking at national health insurance and how to make that available and attractive for those who qualify for national health insurance, ensuring that any kind of private sector health insurance schemes are regulated and have appropriate controls so that the prices don't get too high for the general population. I think that's always a concern in a country in transition. You want to ensure that quality health care is available and affordable for all. And so those will be some of the challenges for the years to come, including really looking at consolidating and integrating services. So when people go for health care, the provider sees the whole person, not just looking at one disease by one disease in a very vertical way.
Last but not least, can you share more about the future plan of the PATH organization in improving and supporting the Vietnam's public healthcare services in the next period?
Well, sure. We've got a number of new projects that are just getting started at the end of 2015, and we're excited about those. Working with some new kinds of partners, looking at ways to get creative using mHealth, for example, using mobile technology to access information about your health or where to go for services, or as tools for providers to keep track of records. So cell phones have become a really integral part of the health system. And so how do we really capitalize on all the lessons learned about using what we call mHealth, mobile health from our cell phones? We're also seeing a rise in chronic disease and non-communicable diseases like diabetes and hypertension. So we'll be addressing those in a more focused way, of also raising awareness of local partners and donors of the real concern about non-communicable disease and some of the issues around access to care when people may be sick and aren't aware of their condition, or may be faced with a lifelong condition that's going to cost them a lot of money in terms of treating that.
Thank you, Mrs. MONA BYRKIT, for joining our program today. And that is although the end of our program Sharing Vietnam. We do hope that with the support of the international organization, Vietnam will develop and enhance the quality of the public healthcare services. Therefore, Vietnam will have to raise the living standard and provide a better quality of life for the disadvantaged people in the society. For comments and feedbacks, please send it to sharingvietnam@netviet.tv.net. Thank you so much for watching, and we'll see you again tomorrow.